The very basic one is ICER, because that's the one that we've had experience with at the Asthma and Allergy Foundation of America. It's the Institute for Clinical and Economic Review, and they're the ones that look at the cost effectiveness of drugs. Their foundation in that, and the way they do that, is through the use of QALYs, which are quality adjusted life years, and that's their main measurement in terms of their value assessment. So, if I were to talk about a couple things just to remember, it's ICER, which is the group that actually looks at cost effectiveness and the ones that we've had experience with, and then what they use is a QALY, a measurement of quality adjusted life years. Yeah, I think there are a couple things. One is thinking about the patient first, because that's what we do as an organization, and understanding how that impacts the patient and reflecting the patient voice in analysis and value assessments. So we try and inventory kind of the work that we do and see how we can reflect the patient voice in the economic analysis that groups like ICER do. So for example, when ICER was doing a review of peanut therapies, we advocated for our community and said, can you include some data on that from our community? So they did a survey with us, and it improved the utility of some of these therapies. So that was really important. And then we've also gone to our board members to ask our board members to see whether they could help opine and give some review of some of ICER's analysis.
Value assessment's fairly new.
Yeah, it is, and I think it's very wonky and tough for patients to understand. So I think the most important thing on this is to remember, like a couple of our treatments were not approved by the FDA yet. So it's most important to make sure that it's FDA approved if this is a pre-review by a group like ICER. But then the most important thing is, make sure that there's hope, and that your patient community understands that these are economic models, and that they don't necessarily have a real impact on real life. And what is important from a patient organization is to amplify the patient voice and to make sure that they understand that while these are economic models, they have an impact on people. And getting that therapy to people is really what's important, and some of these models aren't always correct.